your expertise today, Jen, and now I'll turn it over to you.
Awesome. Thank you so much for having me. I don't have any financial disclosures, and you'll probably learn as we go along. I'm not a public speaker. So I am a person who provides care for people living with HIV in a really rural setting. Some of our patients drive up to 5 hours to get to the clinic to see us. And so I'm just really passionate about sharing the work that we do with others. And hopefully you'll be able to find something that you can take away from our session today that can help you in your own practice. So you can all read there, but our learning objectives for today are to identify primary care's role in the HIV care continuum, explain HIV basics, including HIV status neutral care, testing guidelines, treatment and prevention methods, and then just really to describe the importance of primary care in all of those aspects of caring for folks living with HIV. So if you would look at the HIV care continuum, this is the steps that a person with HIV takes from that initial diagnosis through their successful treatment with HIV medication. But really, I also think about the hexagon before the continuum, right, which is HIV testing and identifying those folks who have HIV so that we can prevent them from getting it in the first place. But primary care has a very important part at every one of these steps. So really, we're the key to HIV prevention. So we have lots of things that happen in a person's life before they discover that they may be living with HIV, right? Like they can experience significant amounts of stigma, violence, shame, homelessness, racism, poverty, all of those things that make it difficult for a person to receive and stay engaged in care affect our ability to diagnose them with HIV. And this is where primary care can have a really large impact in the community. So as we know, in caring for folks with HIV, there's no such thing as a single issue struggle because we don't lead single issue lives. We always think of the social determinants of health, right? Like what other things are happening in a person's life that makes it difficult for them to receive care. And that's not unique to HIV, right? If you look at the diabetes model for care management, these are all things that we need to address to decide if a person is getting the most equitable care. So we look at education, access and quality, healthcare and quality, neighborhood and built environment, the social and community context, and then a person or community's economic stability. And this is something where, especially in rural areas, we struggle with all of these things, right? But especially with distance to care can be a problem. And so anywhere that primary care can kind of step up and we say take the reins in South Dakota, but anywhere where primary care can kind of step up and help with all of those components really makes a big difference in the care that people receive. So the social determinant of health that we often overlook is social and community context, right? So that includes things like stigma, discrimination, racism, safety, community connections, and then a person's relationships with their family, friends, community, maybe with their healthcare provider. When we think of stigma, we think of a set of negative beliefs connected to a particular person, circumstance, or quality due to them having perceived control over that. But really, I just simplify it as any time, and we all do this, sometimes consciously and sometimes subconsciously, whenever we catch ourselves thinking, why don't they just, right? That's stigma in action. So when we catch ourselves, why didn't that person just make it to their appointment today? Or why didn't this person go and get an HIV test? Or why aren't they taking their medications? Really, it's up to us to look into what all of those other things that might be going on that might be impacting that for them to kind of remove that judgmental piece. So just always remember, and if you provide care for people living with HIV, you already know this, right? HIV is a medical diagnosis. It's not a character flaw. And this is something that we see, I don't think it's unique to rural areas, unfortunately. We see a lot in the community that I serve, where there's this assumption that a person acquired HIV because they have a certain, characteristic. Like, for example, they may be struggling with addiction, or maybe they have a certain subset of sexual partners. And that really comes along with a lot of judgment for folks and makes it difficult for them to feel comfortable coming and receiving care. And that's why we always want to just remind everyone that we visit with that this is a medical diagnosis. It's something that's easily treatable. I actually have an easier time treating diabetes than I do or I have an easier time, sorry, treating HIV than I do diabetes. And so really kind of getting that word out into the community that this is something that isn't something that's wrong with a person. It's something that we can easily help them with to feel better and live a healthy life. So if you care for people with HIV, you're wondering, like, why is this lady going over the basics of HIV? And the reason we do this is to just remind folks how simple this actually is at baseline, right? I think there's kind of this tendency in smaller communities or places that don't have a lot of access to HIV care that this is something that needs to be handled by a specialist. And really it's not. And so this is a training that we do kind of with all of our staff when they're first hired with us is, what are the basics of HIV, right? Like for those of us who provide care each day, we know these things, but it's easy for us to forget that other folks might not. So HIV is a virus that attacks the body's immune system. We know that it impacts the CD4 cells in a person's immune system, and it makes it more difficult for them to fight certain infections. It can make them more prone to certain cancers, and it's generally not curable, right? Although in some unique trials, some folks have been cured, but the odds of that coming available to numerous people in the near future isn't very reasonable. And if it's not treated, it can lead to acquired immunodeficiency syndrome or late stage HIV. So simply put, this is spread through blood, semen and pre-seminal fluid, rectal fluids, vaginal fluids, sometimes through oral sex, IV drug use or sharing injection equipment, needle sticks, pregnancy, and breast milk. Now, of course, through pregnancy or breast milk, if that person doesn't have an undetectable viral load. So women who are pregnant, who are living with HIV and take their medication will not transfer it to their baby, and same thing with breast milk. So there's obviously a lot more that goes into that. But the reason I have this slide is, we have a full HIV program at the clinic where I work. And we forgot to do the training with our X-ray technician. And so she had a patient who came back asking that needed an X-ray, and she came back and asked us if she needed to put gloves on. And that was really like a highlight for me of where we had missed teaching the folks who do this work with us, kind of those simple things that the rest of us just already know.